Hello there, my name is Dingba Peter. I am the host of the YiBF podcast. Today, I am privileged to have someone very special. I mean, it's just a chat, really, a business chat, really, on how you as an SME, you as a startup, can go from where you are to where you want to go. And today, we want to focus really on the medical space, on the diagnostics, and the whole world of medicine. All right, how do you start an innovative medical startup? How do you raise funding? How do you scale? How do you go global? And those are some of the things we are going to be discussing today. I'm privileged to have Dr. Olayemi Dawodu. Welcome, ma'am.
Thank you.
Yeah, so let's get straight to it. Talk to us about the Clina-Lancet journey, the Clina-Lancet story. What would you say is the Clina-Lancet story?
The Clina-Lancet story, I would say, is a story of growth, of innovation, of excellence, and one that is hinged on quality in the Nigerian healthcare space. And we are a large entity that is recognized as a large shareholder in the diagnostic healthcare space in Nigeria.
All right. So I understand that there's a form of a fusion between a Nigerian brand and a South African brand, that gave birth to this. I mean, talk to us about that.
It's actually much more than that. So in 2012, there was a merger between Clina-Labs, which was a pathology laboratory that was owned by two indigenous physicians in Nigeria, Professor Akinyoju and Dr. Sonny Kuku. And in 2012, they had been around for decades. I mean, having very well-recognized, wide range of tests, known for quality, and also responsible for a large market share of performing pathology services in the Nigerian healthcare space. And in 2012, the group was approached by a South African group known as Lancet Laboratories South Africa, which already had branches across Africa. At that time, I think they had about 10 to 12 branches across Africa, and they were looking at coming into the Nigerian market. So in terms of getting their footing into the Nigerian market, they obviously came in and searched for viable businesses that they could merge with to be able to also take part in the large market share in the healthcare space, and identified Clina-Labs as a viable partner to partner with. And this happened in 2012. Clina-Labs on its own already had branches across Lagos, as well as outside of Lagos in Warri at that point in time. So Clina-Lancet was born in 2012 out of that merger. And after that merger, Clina-Lancet then also grew or opened more branches across more areas in Nigeria. So we have branches in Ibadan, Port Harcourt, Abuja, Warri, Delta states, like I mentioned, as well as the 5 to 6 branches that were in Lagos. And then in 2019, which I did mention earlier, Clina-Lancet further evolved. So now Clina-Lancet is currently a business that is owned by a French majority shareholding of Clina-Lancet Nigeria is a French company known as Cerba Healthcare, with the head office in Paris. And Cerba Healthcare has been in existence for over 40 years, performing a large volume of pathology services in Europe.
I want to dive into the business dynamics. So there's something about mergers, acquisitions, raising equity funding. Now, when a business gets some form of funding, the original shareholding of whoever the initial investors were gets diluted.
Absolutely.
Right? And then when there's another series of merging or another round of raising funds, it also still further dilutes that shareholding structure. So I want to speak to that, right? So before now there was Clina-Labs, and the founders had, I want to believe, 100% shareholding.
Absolutely.
Then there was a merger with Lancet.
Absolutely.
There was a dilution. And now another merger with
Cerba Healthcare.
So, I mean,
France.
What impact has that, had on the original shareholding of the founders?
Absolutely, further diluted. That's what happens because now the South Africans were the major shareholders in 2012, and from 2019 till date, the French now have the larger shareholding. So obviously, there's a dilution across the shareholding of the organization as well.
Okay. I mean, let's come into something that's a bit more personal. Let's talk about it. Yeah, let's talk about it. Talk to us about the journey that led to you being here today. Today you are the CEO of a when it comes to the laboratory world, it's no brainer. Clina-Lancet is number one as far as Nigeria is concerned. So talk to us about the journey that brought you here as a CEO.
So I would usually say that my journey was not very conventional. And why do I say so? I studied medicine at the College of Medicine, University of Lagos. I did my specialization in pathology at the Lagos University Teaching Hospital, and I finished in 2014. In 2015, I applied for a job as the pathologist, anatomic pathologist for the country, for Clina-Lancet Laboratories, and I was employed in February 2015 as the country histopathologist.
So
yes.
Oh, wow.
And in 2015, February 2015, I joined Clina-Lancet, and I worked as the country pathologist, and my job was to process all the samples that came from across Nigeria and read the samples and also liaise with my doctor colleagues in giving correct diagnosis on the tissues I received as a pathologist. And I really thoroughly enjoyed doing that in Clina-Lancet because I got a lot of growth in terms of my network with my colleagues, and it was also a way to form very strong relationships and partnerships with clinicians because we had the common goal of getting the best outcome for the patients. And for me, I absolutely loved interacting with them and solving all the problems that came to my table for solutions as the pathologist.
Let me speak from the HR angle, because sometimes when somebody joins an organization, when you join Clina-Lancet, was it as a junior staff or as a senior staff?
I would be considered a senior staff as a pathologist.
Or as a pathologist, a senior staff?
Yes.
So then, how were you able to manage the HR concerns? Because naturally, as humans, people can have that attitude that, hey, we've been here for 7 years, we didn't make us the pathologists, we're not the boss. So how were you able to maneuver all of that onto, then becoming the CEO?
So to be honest with you, as I said, authenticity is what I would say it is. I never for one day was not myself. What do I mean by that? I interacted within Clina-Lancet, and I also interacted with my fellow pathologists in South Africa, who, interestingly, the chairman of the board of Clina-Lancet Laboratories Nigeria, a South African called Dr. Harry Passard, was in South Africa and is an anatomic pathologist. So we actually had a very good relationship because I used to be in touch with him a lot of times concerning work and all those kind of things. And basically, I was just doing my job as the histopathologist and interacting within the system whenever it was necessary. And so it wasn't something that I came into Clina-Lancet conceiving to say, it's my ambition to become the managing director. I was just doing me, is how I would put it. And what is me? I worked hard. I was very focused. And, basically for me, that was it. And obviously, it was evident in the value that was added because the growth that we also had in the period from when I came on board to when I had to transition into the managing director was evident. There were people who didn't used to want their samples read in Nigeria when I joined and preferred for it to go to our South African colleagues to read it. We had almost 50% of those people retain their samples to be read in Nigeria about 6 months after I joined in. And it was based on building the relationship, the trust they had. And it was time tested that most of the diagnoses I was making were actually accurate to help them.
Doctor, I want to speak about the diagnostics world. We've had instances where, some labs read someone's results wrong, and then the doctor is administering the wrong stuff, and then it becomes a major issue. At what point do you think labs get this thing wrong? at what point in the entire process do you think it
I think it's ab initio because it depends on the kind of systems you put in place in terms of your processes and your quality management systems and quality assuring and quality control of those results before they go out. And those processes help to mitigate some of these things. So there are alarm bells that would go on and trigger actions that make you recheck or to get a second opinion before you then turn them out. So having a solid quality management system, you hear me talking about that, but it is the bedrock of getting the best diagnostic results in any space, implementing those things. And so I was speaking to you about in Clina-Lancet, we do not run any patient sample without our internal quality control passing. What does that mean? And we do this 12 hours a day. So twice a day, there are controls that are run. Controls are standard known entities. And if the machine does not pass that control, no human being sample is passed through that machine that day. So putting in and regulating those kind of things help. Then we do not play with proficiency testing. What do I mean by proficiency testing? Entering into a program where for someone like me, they give me 20 slides and I cannot miss more than 1 or 2 slides for me to continue to say that I'm abreast with what I'm supposed to be doing and people can confidently send it to me. We have programs like that in Clina-Lancet that we embark on every month for everybody that is taking part in analytical work on the bench. There's a monthly external quality assurance system. And this is with contemporary laboratories across the world. And so that is what I was talking about when I said in terms of international best practices is actually what we have as the bedrock of the system in Clina-Lancet Laboratories. Let me think. When you say pitfall, clarify for me.
Okay, so Toyota, they made electric cars in the heat of Tesla, in the heat of the different the world going great essentially. And then just 2 years after, they started recalling their first set of electric cars because they began to see major defects. Samsung got a bit tired. In the heat of iPhones and all of that, they began to recall. I think it was R7, because it was a
Battery.
It's interesting how their emissions were messing with aeroplanes, receivers, and all that. So it was that bad. They had to start recalling all of them. So what would you say in the light of that? I mean,
No, maybe not saying juicy, or maybe in terms of expanding into other areas. So not saying doing so well. I think that currently what is beneficial is to have a one-stop shop. And what do I mean by that? What currently Clina-Lancet models is independent pathology laboratory. But if you would incorporate something like a radiology, it would also augment the retention of some of the clients that you have and even attract more. Because by and large, sometimes people have to run tests and they have lab tests and x-rays. And so if you can come in and do your lab test and an x-ray here, you don't lose revenue, because sometimes because they cannot do the x-ray, they take your revenue where they can do everything. So I wouldn't say it's a mistake, but it's about evolution in terms of needs.
Am I the only one observing that? I asked for a pitfall, and she's telling me, oh, it's generational. It's okay. It's okay. Let's talk about the earlier conversation we had. You spoke about
Yes.
So I'm struggling to put that together in my head. Like you got your first job in 2015, and then 7 years after, boom.
Well, actually, I became the CEO 14 months after.
Huh?
Yes.
Really?
Yes. And I will confidently say it might sound, that would be the first reaction. How? What? And I talk about how I was really just focused on my pathology. But I'm a very quick learner. I tell you that confidently.
I just want to take this question away to be sure that we're on the same page. Clina-Lancet will be your first job.
Absolutely. What
First job.
first job in terms, when I say first job,
Yes.
first job as a specialist.
Oh, right.
No. So we need to paraphrase
Clarify.
that. Definitely had a job after I finished from school. Also, I worked as a medical officer, and then I up for 2 years, and then so maybe I didn't paraphrase that well. When I finished from medical school, I did my NYSC, and then I did 2 years as a medical officer in a specialist hospital. It was into maternity and pediatrics. And then I went forward to do my pathology residency. And after my pathology residency, this is my first job as a specialist in terms of being a pathologist. Yes. And so after I finished pathology, my first job as a pathologist was with Clina-Lancet Laboratories, Nigeria. And as I said, I joined in February 2015.
No thought whatsoever of becoming CEO.
Absolutely not. Absolutely.
What would you say is responsible for
I always say, and it's not being cliche, I think you should always be your authentic self. I'll say that again. Always put your best foot forward. To be honest with you, I won't be able to categorically tell you what.
People have put their best foot forward.
Yeah. And I totally agree with that. I can't, if I'd honestly be able to say what it was that made my chairman approach me to say, we want you to take the job, I can't categorically tell you, but I can categorically get Grace properly. And maybe he probably saw some work ethic I don't pay attention to, and I was just being me, and he felt confident that we can hand this to her.
Oh, this conversation was
But I mean, I totally get what you're saying, and I understand the aha, because it is an aha thing. And even I questioned, why would you want to give me the organization? But sometimes you don't see in yourself, or you don't, let's not say see, you don't see or acknowledge in yourself what you are. I'll be honest with you, I've always had very strong leadership style and traits, for sure. Like I said, I was the chief resident in my program. You're not picked as chief resident because you have poor leadership skills. So there's something that is in you that people have entrusted that role to you. And so
let me speak to you from a business perspective, a medical business perspective. Now you sit as a CEO of a major if you have to speak to some disruptive, some technique, in medical field, who is looking for a disruptive career, where will you ask him how to work? What new things of the system that is a young guy, a young medical person, young lady that say, hey, boy, girl, you can do it.
I would still say health tech. It looks like it's saturated. It's not saturated yet. There are a lot of apps that have come up, but I'd ask them to look for a solution that scales, a solution that is borderless, and a solution that caters across the healthcare system. And what do I mean by that? Because sometimes some of these solutions or organizations seem to be skewed to a certain social strata. I would say think grassroots. Grassroots, global grassroots, if there's something like that. Because the numbers are in the grassroots. Think of an innovation that caters to being able to create a means of access and scaling and encompassing in terms of universal healthcare coverage that spans across the healthcare system.
What would you say I am a technology person, right? Just having a chat, just like this, like, hey, what would you say is that technology?
I would want to use drones to fly my samples to feed certain testing platforms. In terms, yes. So if you came to speak to me, I'd tell you to create an innovation for me that can help me take something from Nasarawa, Niger to my Abuja lab to be able to test in a remote area.
So that's a niche, that's a need, so to speak.
Yes.
Is there anyone who can do that?
Not that I know of. But absolutely, that is what it is in terms of reach. And we're talking about road travel, and even within the metropolis of Lagos, you give me a drone service where I can secure those samples, and the cold chain is maintained, and we fly it around.
So essentially, somebody walks into the lab, you take a sample, or we're able to take this sample anywhere.
So somebody in Nasarawa, I have what I call a depot. It's not a testing site. Abuja has all the machines that we test. They go into Nasarawa. I have a staff there, one or two, that bleeds them and loads it on the drone. And it can be from Kwara, and it feeds Abuja lab to run those machines optimally. That is a gap that I think we haven't bridged, and it will cater to accessibility as well.
What if we're able to create an app that's able to do that without having specific?
Well, if you could feed me in on how the app would get physically the blood test there, I'll go with you.
So we still take the
sample, yeah.
Basically, then perhaps drop it on one machine or something right there and there. There's an app in the machine that just interprets all of that.
No. So when it comes to point of care, I actually have something currently that I'm even working on, and I'm very, very skewed to primary healthcare. In as much as we're in the space that we're in, that area has the numbers. That area needs our impact, and that area also needs the solutions, the quality solutions that we see in the lab, in our technical platforms, at that level, but not necessarily using the big machines. So in this regards, that innovation is point of care, but point of care that employs the same quality systems and standards that you will have in the big lab. So like you said, they drop and you can read parameters for them from there and transmit it probably to a physician to be able to give some sort of intervention. Yes, those kind of solutions too are very welcome.
So, you know, in the wake of telemarketing,
yeah, I think they have the role that they play is very significant and is very important. And I think, just like you said, after the pandemic, we can't do away with it. They came to the fore within the pandemic, but the algorithms they work with, there's intelligence and softwares and permutations that they work with that help to give good directives in terms of what the next step is in managing the patient and directing them to get some sort of consultation and even prescription. So I think it is a big part of innovation.
How do we get that knowing that, for what you said, it is an algorithm that elevates effort. So without a solid lab test, I would assume that all telehealth does.
Yeah, but I mean, that's what I said. So it can tell you this is it, but part of what they do as well is to refer you. Maybe not all of them do that. You know, there are some, all they are doing is they provide this platform for you to be able to get Clina-Lancet and some likes of them and to pick tests. And then the people come to their houses to take those tests and send to a Clina-Lancet. That is one niche. Then there's the niche of, oh, I have a headache, my eye is red. And they actually schedule you to be able to interface with someone remotely. But it stops there in terms of their limitation is that they can tell you clinically this. Not yet. And so that's where the area, because it's still evolving. And so certainly there is going to have to be policies put in place, regulation, and very importantly, earlier today I was speaking somewhere and spoke about that, the policy on data regulation. And so you're going to have to be properly vetted, audited, and regulated that you're not abusing or misusing those data. But I think they know their limitations more of the time. They are not trying to do beyond giving a clinical diagnosis as far as they can, and then saying to you probably go run this test somewhere to confirm if this is what is going on and all that. So it's still evolving is what I would say. I'm sorry, I found this question weird. Oh God, what would I
Just
say?
want to write yeah, old self, yeah, and all the nicknames.
Yum yum.
Yeah, yeah. Right. So one of the letters, yeah, yeah. What would you say? But now you have the advantage of new confidence. Because then you're speaking to them, so you're saying out there,
I would say trust yourself. Trust yourself. Opportunities don't come to you. And like I said earlier, you evaluate yourself with certain eyes, but sometimes you don't know what somebody else sees in you. As in, confidently trust yourself to show up. Yeah, if that makes sense. So, I mean, I'll be honest with you. If somebody came to me and said, "Oh, I want you to be the MD," it shouldn't be. And let's not go into gender. It shouldn't be a thing of, "No, I didn't come here for that. I just want to be the pathologist." It should be, "Okay, what does it take?" Trust yourself and own it. I am not at liberty to say.
not that me. All right. All right. I'm not going to push. Well, I mean, those are public information. Foundations,
A couple of
millions of dollars. I know. All right. What will be your opinion?
you just say thank you. And then in terms of being entrepreneurs, please dream big. Be the solution and innovator to a gap or the problem that you see. And as I said earlier, your dream is so valid. We're waiting for you to impact the world. Yeah, so I can conquer. This is so personal. I mean, to be honest, I don't really have such strong opinions about it. I do know by virtue.
You are not a writer. Because if anything's going to happen, that's the formula. How does the lady know right? So you've seen, you understand the issues when it comes to pregnancies, you understand the issues, because sometimes when you do those tests, perhaps you ask them questions, and then the story,
Exactly.
So then, what's your opinion, calling all of the experiences interacting with ladies, doing lab tests for
Right. So, I mean, when I say that, even though when I say it's personal, from a medical perspective, there are absolutely reasons that justify that. Not the overturning, retaining the law for you to have the rights to be able to do that. I mean, if someone ran a test for NIPT and they knew the child they were going to give birth to would have some abnormalities that would make it a difficult life for the child and wanted to take that decision, I think those are choices that can be made that are serious. Or circumstances like someone was raped. I feel strongly, I think the person should be able to have the choice to take that decision. Honestly, I wouldn't be able to speak to them because a lot of things are politically motivated as well. I honestly don't know what the rationale was, even in revisiting it to overturn it exactly. I honestly can't speak to that, but I would say in my own part that there are circumstances where I absolutely think it is necessary to have the choice to be able to take that decision. Absolutely the center and important. I do. I do. I'd like to say thank you very much, Kende, for all the support through the years. He's absolutely an amazing partner. He's great with the children and he's always supported my dreams. Even when I had to have sleepless nights on call when I was doing residency, absolutely supportive in every decision. And even in being here, he's my sounding board and I'm so, so lucky to have him. And then I cannot take away the role of my parents. My parents have been a rock because they have also come in to support when I also needed childcare and support during my training and even during these periods when I have to travel and probably my husband is busy as well. And my children for tolerating sometimes my crazy schedule. So I want to say thank you for. I mean, family is absolutely the backbone and bedrock of being successful in what I do.